morning. Welcome to Rochester Regional Health, United Memorial Medical Center. I'm Dan Ireland. I'm the president of United Memorial Medical Center, and on behalf of our leadership team, the board of directors for Rochester Regional Health, I'm very, very happy today to welcome Lieutenant Governor Kathy Hochul and some of our local legislative leaders here to join us today and to really celebrate some great improvements that are happening in healthcare in our region, and to be able to talk about some of the great things the governor's office and Lieutenant Governor have been able to help us achieve, and the seeds that we continue to plant as we go into the future. So I will turn it over to Lieutenant Governor and welcome and thank you for being here today.
Well, thank you, Dan, for the warm welcome here on this rather chilly day, but I guess this is just a precursor. We're going to look back and say this was a warm day at some point, so I know not to get ahead of that. Also, you may not know this, but this is New York State's second annual Workforce Development Week. Yesterday, I was in Manhattan and in Westchester announcing grants that assist local businesses and apprenticeship programs and private sector organizations that are training people for the jobs that we believe will be there not just today but for tomorrow. So that is why I'm here today. I wanted to come back to Western New York, to Batavia, to make an announcement along those lines as we reaffirm our commitment to the importance of investing not just in buildings like we did a few minutes ago over on Main Street, but also investing in people and in giving people the ability to have a career that is going to be long-term, and a career that is going to benefit others, as healthcare jobs do, but also to make success more accessible. And that's the premise behind these workforce development grants that we've been announcing throughout the state. And when you think about where we are today at UMMC, I don't think 7 months ago, 8 months ago, we would have appreciated so much the way we do the value of healthcare workers and people who are well-trained and who are selfless and who are willing to run into literally the line of fire, put on a uniform and show up every single day, even though they're putting themselves at great risk as they try to save lives during a pandemic. So people that may have been taken for granted for way too long, I think hopefully feel our heartfelt gratitude from every New Yorker and everyone in this country for the healthcare workers that we have. But also this exposed a lot of vulnerabilities dealing with this pandemic. The fact that we don't have enough people who are trained LPNs, people in the healthcare facilities, and that's what we're talking about today. So to Dan, I want to thank you for your work in this facility to help areas like Batavia, which have a urban flavor, but you also expand way out into rural areas. And this was always a challenge that I experienced in talking with our chair of the legislature many times about the needs of the rural poor, people who have health needs in the rural areas and don't get the service they need. So you're providing that, and I want to thank you for that as well. Also, I'm here. I also want to recognize Stephen Hawley, a great partner of ours, the governor and I in our state capitol, for all he does for this area as well, a strong advocate. And I do miss our parades. We used to march in a lot more parades a little while back. We'll get back to that again. Also, I want to recognize Deb Stamps, who is looking very sharp in the green suit there, very bright and happy today. The Chief Nursing Education Officer, who you could just feel her commitment to the cause of giving people an opportunity for a good career. There are a lot of people out there who may want to go into nursing training, but they have to make sacrifices. If they're in a training program, how are they going to still have income coming in to support their families? So that is why the announcement I'm making today that, first of all, statewide, we're announcing New York has been awarded over $18 million from the federal government to fund educational opportunities to train New Yorkers for in-demand jobs, support entrepreneurs, and help small businesses recover from the pandemic. New York State was only one of 8 states to win this funding. And so we're very proud that we now have the ability to get this out into the communities. And part of that is $200,000 that we're announcing and for the programs here to train LPNs, to give them stipends, to give them assistance, to continue their education so they literally can be hired here and to serve other members of this community and to fill a void that we now have because of the shortage of healthcare workers. So congratulations on the $200,000. Congratulations on being part of our Workforce Development Week as we continue to focus the spotlight on coming through a pandemic. It's not just about investing in the businesses, it's about investing in people. And there are a lot of people who thought they had a secure job before the pandemic, and their lives have been turned upside down. The unemployment rate went off the charts. It's starting to get a little bit more manageable, but we are facing unprecedented levels of people who've lost their jobs through no fault of their own. Literally, the job that they thought would be there was removed from them, knocking people off their feet. It's been a tough time for the people of our state, and workforce development gives people a chance sometimes to think of a whole new career. Careers that they thought they were stable in. There may be some industries that aren't going to come back the way they've once had been. Hospitality, restaurants, other areas where companies are reimagining their future to make them also make sure they're profitable and successful, and it may not be the same number of employees they once had. So what do we do with those employees? That's what this is about, giving them opportunities, whether it's to go into healthcare. I can guarantee, sure as I'm standing here, there's no way a robot's going to replace a nurse walking in the room and taking care of somebody. We'll always need that human touch. And so thinking about the careers of the future that make sense for people, that I'm continuing to push people into, it's the tech careers, but it's also the people-serving careers. We need a human to actually conduct the business, and that's what the nursing program is all about. So I am happy to announce this today, $200,000. Congratulations, as part of an $18 million federal program overall. Oh, I'm sorry, I missed the city council presidents here too. Everybody looks so in their masks too. I'm sorry. Gene Jankowski, who joined us just a few minutes ago downtown for other announcement. So I come out of local government. You never overlook the local government people. They're the ones that are actually where the rubber meets the road. You're the most accessible, and I thank you for your work, President Gene Jankowski. So I will leave at this point, and we'll take some questions in a few minutes, but let's hear from Dan again. Thank you.
Thank you, Lieutenant Governor, and I can't tell you how much it means to our team and our community to be able to be awarded the money that you've been able to help us receive. Every day when we talk to people we're recruiting at the hospital, and we talk about career development, and many of them stop and say, I just can't afford it. I can't afford to go on to be a nurse, but I have the passion, I have the skill, I have the aptitude, but I have a family to raise, or I don't have, I've got parents that I'm caring for at home, and I can't afford to take off time. These funds will make a difference. They will make people be able to move on that pathway, to follow their passion, and then it allows us to bring those folks back and have them here at the hospital, have them in our community. I was pleased to be downtown with you a little while ago as we were celebrating the start of some of our DRI projects, and there's many more on the horizon. And those bricks and mortar projects are going to open up opportunities for these nurses that we're training to be able to go in and work, not just in the hospital, but to touch our community. And that's what we're about here. We're about making our community better, making them healthier, preventative care, as well as dealing with chronic illness and acute care. And so your support and your help makes the whole package come together, not just the bricks and mortar that Eugene and I and a number of the leaders in the city worked on and the community worked on to get those DRI projects into shape and down the road, but also to bring the people to work with that. So again, on behalf of the team here, I know my partner Deb Stamps and I working very hard to offer opportunities, and the great school that the Isabella Graham Hart School of Practical Nursing allows for us to link people up with. All of us together. Can't thank you enough. I can't express enough of my appreciation for all of our legislative team. Steve and I worked on a number of things. Shelley and I on the county projects, and Eugene as well. So, Lieutenant Governor, for you to make the time to come here on your busy schedule, I very much appreciate it. Our team appreciates it, our board, and we're very excited for a future that's going to see healthcare thriving and growing coming out of this COVID-19 period, and we are grateful. So, thank you very much.